Dear participants, we are starting now, so please keep yourself mute. Thank you.
Good afternoon, everyone. Myself, Saloni Singhal, a final year student. Today, I welcome you all on webinar on recent advancement in hamstring injury. Today, speaker is Dr. Sai Kishore and shall be taking session on recent advancement in hamstring injuries. Dr. Sai Kishore is an experienced sports physical therapist, being the first Asian to be nominated as one of the network facilitator for World Physiotherapy Network for health promotion in life and work, a network of the World Physiotherapy based in UK. He has worked on several projects, main one being physiotherapy for astronaut, a descriptive study which was appreciated by then President of India, His Excellency Dr. APJ Abdul Kalam. Also, he is the first Indian to carry out research on muscle dysmorphia on Indian bodybuilder, a psychological perception of body image. He is a certified international educator of Elysium Academy, Greece. He has more than 400 hours of on-field experience in medical injury management through various international and national level sports events. He is expertise in handling high-risk athletic injury, trauma, injury management, and rehabilitation. Expertise in exercise prescription, pre-participation evaluation, high-intensity interval training, and calisthenics. Expertise in weight loss therapy through exercises. His research interests include exercise prescription, sports performance assessment, health performance in lifestyle disorder like obesity, diabetes, cardiac health, aging. Sir has 4 publications on his part and delivered over 11 invites lectured in various conferences and seminars. Now, I hand over the session to Dr. Sai Kishore.
Thank you so much. I hope the screen is visible. Okay, good afternoon, everyone. I know it is pretty hectic after a lunch session. I'll make sure it is short and crisp. If there is any issues with the screen or display, just let me know in advance. So we're going to see in detail about hamstring injuries and what all its management and everything in detail. So to understand hamstring injuries, we need to understand what muscle contraction exactly is.
Striated muscle is made up of bundles of multinucleated muscle cells called myofibers. A myofiber is packed with myofibrils that extend the length of the cell. A sarcomere, the functional instructional unit of muscle, consists of thick myosin filaments and thin actin filaments. Titin keeps thick filaments centered during contraction. In muscle contraction, actin filaments slide past myosin filaments. Neither filaments change in length, yet the sarcomere becomes shorter. The force required for this movement is generated by myosin heads, which make cross-bridge attachments to actin. Myosin heads walk along an actin filament, using ATP for energy. Tropomyosin is part of the complex that prevents myosin from sliding along the thin filaments. A myosin head binds ATP and as a result, detaches from the actin filament. It rebinds in a new position. Phosphate release triggers a power stroke that moves the actin filament. ADP disassociates and the process is repeated.
Okay, so in short, any muscle contraction happens due to the actin and myosin filaments movement. So in order for an injury to take place or a muscle contraction to take place or a muscular strain to happen, there will be a mismatch in this movement of this sarcomeres or the actin myosin. If there is even a minor mismatch, it's going to end up in a muscle strain. So hamstring injuries are identified as the most common non-contact injuries ever. So what we are going to discuss here is the pathophysiology, epidemiology, mechanism of injury, the types, risk factors, diagnosis, how we're going to treat, rehab protocols, prevention, and then return to play. So if you see the pathophysiology of a hamstring injury is not that clear. However, it is characterized by the inflammation and edema and to some lesser extent of bleeding in severe cases. If you see the epidemiology of the hamstring injury, it is one of the major injuries happening in sport. Hamstring injuries can make up from 6% up to 25% of all sports injuries. A high number of hamstring injuries occur in sports where the hamstring is stretched eccentrically at a higher speed, such as in soccer and athletics. 70% of all hamstring injuries are of acute onset, whereas 96% of hamstring injuries happen in a non-contact situation where there is no contact at all between the players. So if you see the mechanism of injury, it is the biceps femoris, the long head of biceps is the most commonest injured muscle, which occurs due to excessive stretch or tear of the muscle fiber. So it is always a multifactorial event that leads to a hamstring injury, such as muscle weaknesses, decreased flexibility, the posture, fatigue, and as well as the load that is happening on the muscle. So in general, we have three types, like grade 1, which is a muscle pull, grade 2, a complete or incomplete or a partial tear, or a grade 3, which is a complete tear. However, if we go in depth, there are various classifications and types of hamstring strain. There is a classification for an acute hamstring strain with respect to the mechanism of injury. Type 1 hamstring strain occurs during high-speed running at a terminal swing phase when muscles eccentrically contract to decelerate the swinging limb. That is, in general, when somebody is running at a faster pace, during the gait cycle of running, the injury happens when the muscle, before the foot strike happens, when the swinging limb is coming in deceleration. And here the long head of biceps femoris is the most commonly involved muscle here. Now I would like to present a small video.
A heartbreaking performance from Usain Bolt
considered as Usain Bolt is considered as the fastest man on the planet, and this is his final race. And after this, he is supposed to retire. And what unfortunately happened was a hamstring pull. So this is a classical example of.
was expected to be a golden fairway.
So that is a classical example of running hamstring injury. Now that is a type 2, which occurs due to excessive lengthening of hamstring during dancing or a sliding movement or slight tackling, such as in soccer, or high kicking, or any movement that involves a combination of hip flexion as well as a knee extension. Here, the proximal tendon of semimembranosus near to the hamstring origin, that is a ischial tuberosity, is commonly involved here. Now, if you see the sliding and kicking activity, which is very common in a soccer arena or a football. So as the person slides, there is a combination of hip flexion as well as a knee extension happening here. So this can lead to an injury. So as I said in the previous slide, 96% of hamstring injuries happens in a non-contact environment where the person self-injures themselves. Okay, what are the risk factors? Age, the training content, the fatigue, monitoring of workloads can be considered as risk factors. every 1/3 of sports injury is a hamstring injury. So that denotes how frequent and how freakish it is. The incidence of hamstring injury during matches and training sessions are, it is almost 0.43 to 3.7 hours of exposure. Say, for example, if there is a warm-up or during a training period or a pre-match warm-up is happening, within 1 hour, there is a exposure or a chances of injury. So how do you diagnose? Scientifically, there are some sports science predictors such as the IGF2 gene, CCL2 gene, which can predict muscle damage and the extent of injuries. Genetic testing can be done by a simple throat swab. The Nordboard hamstring testing system and FIFA 11+ programs are classical examples of diagnosing a hamstring injury. So I presume everybody would have seen or experienced a Nordic test, where the knee is flexed and the ankles are supported. The person slides their trunk where the hamstring eccentrically loads. So it's combining advanced sensor real-time data visualization on a Nordboard. So Nordboard is something recently invented to support the Nordic test. FIFA 11+ is a scientifically designed program. It's an injury prevention program specifically designed to prevent football injuries. There are some 15 exercises divided into 8 components, whereas running injuries, strength and plyometrics, and running exercises. So all these, it is a combination of various exercises combined together as a one protocol. So now coming to the biomechanics of the injury, hamstring injury. High-speed running injury at a terminal swing phase of gait cycle, the greatest stretch incurred by the biceps femoris. So biceps femoris is more commonly injured than compared to the other two muscles, semimembranosus and semitendinosus. So typically occurs along the intramuscular tendon or at the aponeurosis junction. So if you see the presentation, the person with a hamstring strain or a hamstring tear will be clutching that region, and there may or may not be ecchymosis as shown in the picture. The history is of sudden onset. Oh, sorry about that. The history is of sudden onset at the posterior thigh pain, localized swelling, tenderness, and possibly a palpable defect will be there. Ecchymosis or presence of blood within this around the muscle could be present. A passive SLR on the contralateral side will be decreased. Active slump test could be sensitive. So again, this is the radiological imaging of what a hamstring tear or a hamstring injury would look like. So ultrasound, Doppler, MRI, or supportive radiodiagnostic features that could help or detect accurately a hamstring tear. Now, coming to the main important thing, the classification. We have seen the types, we have seen what are the grades. Now the classification. O'Donoghue is a researcher who graded the hamstring into 3 grades, where grade 1 is no appreciable tissue disruption, no loss of function or strength, and only a low grade of inflammatory response, whereas it is a very minimal case of injury. Grade 2 deals with acute tissue damage with decrease in strength at the musculotendinous unit. Grade 3 is a complete disruption of the musculotendinous unit. Poor prognosis is something very important, where the injury is close to the ischial tuberosity or close to the hamstring origin, or a central proximal hamstring tendon is injured, a stretch type of injury, or a previous history of ACL surgery on the same limb can lead to poor prognosis, where there will be a delayed healing or a delayed return to play. The regular management, if you see, it is a RICE protocol, cryotherapy, early muscle activation, eccentric exercises, thigh wrap compression, all these things. And even electrotherapy modalities can be tried, but it will not be a complete solution for that. So as I mentioned, the ultrasound and a subacute phase may help in tissue healing, but not to a greater extent. Pharmacology, if you see, analgesics, NSAIDs, and to some extent hyperbaric oxygen therapy can enhance healing. Surgery is recommended during only if there is a complete tear or an unresolved hematoma or ecchymosis is there. coming to the main advanced management. I mean, there are some advanced management techniques such as PRP injections, autologous blood injections, that is also available. The rehabilitation, which is the most key aspect of a muscle injury, and especially considering hamstring, it is a very, very tricky thing. Rehabilitation can extend from 3 months up to 6 months, depending upon the type of the injury and the nature of return to play. So, primary goal of any rehabilitation is return to play, the minimizing the risk of reoccurrence, and considering the training parameters the athlete is going to put into after the rehabilitation is over. So there is something called as the Mendicuccia protocol, which recommends a shorter rest. However, if the rest is too short or too long, the recurrence of injury or re-injury is higher. Cryotherapy, elevation and compression, usage of crutches in case of severe damage. Early mobilization is recommended by this protocol within 3 to 5 days of any hamstring injury, which is in the subacute phase. Mobilization or the movement of the athlete should be encouraged. So what exactly happens is a progressive stretching and strengthening, isometrics as tolerated, slowly progressing into isotonic and isokinetic exercises, then progressing into cardiovascular training, and at the final stage, core stability exercises. So if you see what exactly happens during an early mobilization during the subacute stage of 3 to 5 days is, there will be increased clearance of inflammatory cells, increase in rapid regeneration of muscle fibers, that is the sarcomeres, increase in restoration of contractile properties, increased tensile strength, revascularization of the damaged area where there is increased blood circulation, and healing, better healing. So these are all the key advantages if a proper mobilization and exercise protocol is provided during the subacute phase. So in case the subacute phase is missed and the person is in the chronic phase, tissue remodeling should be promoted. Increase in functional exercises, strengthening exercises should be encouraged. Sport-specific skills, if it is an athlete or a cricketer or a bowler or a soccer player, sport-specific skills needs to be promoted and stimulated periodically. And the most important thing is return to play should be considered. Scientific exercises, which means scientifically research-proven exercises, such as the eccentric muscles training, Nordic hamstring, standard leg curl exercises, Romanian deadlifts, and most importantly, the ASKLING'S L protocol. ASKLING L protocol consists of 3 exercises: the extender, the driver, diver, and the glider. So each exercises, the extender is given twice a day, twice every day, 3 sets of 12 repetitions. The person is lying in supine position with the legs as given in the picture, as described in the picture. So the diver is again in a unilateral limb stance with balance, affected limb elevated. Then comes to the glider, where the kinetic chain stimulation is happening. So a progression can be made in this same manner or the posture, where you can encourage the person to use ankle weights, kettlebells, or therabands, or even a slider mobilizer exerciser. So if you see the ASKLING protocol, some simple analytical exercises, the performance is encouraged through the kinetic chain. If you see the first column, there are some 5 exercises: acute phase, and then the subacute phase, where 4 exercises, and then the functional exercises. So we start from isometric exercise, slowly progresses into kinetic and kinetic exercises, and then we take it to the functional exercises, where sport-specific strengthening and training are stimulated during the course of rehabilitation. Now, the important thing, return to play. So, closer the lesion to the ischial tuberosity, longer the return to play will be. There is no correlation of ultrasound findings relating to early return to play. If the ultrasound findings denotes less muscle damage, doesn't mean that the return to play will be very easier or quicker. Doesn't correlate with that. Relationship size of injury lesion on MRI, length, cross-sectional analysis, and signal volume, and return to play, which means there is no stronger evidence an MRI can predict during the prognosis time of a return to play. In general, what it means is that radiological diagnosis can be a predictor factor. However, it is not directly correlating to the return to play, because return to play directly happens, directly proportional to the healing, the type of rehabilitation happening in the subacute and the chronic phase, and what type of functional activity the player is put into. All these determines the return to play to the sport. Chances of re-injury happens in hamstring during if the rehabilitation is unstable, poor return to play guidelines are followed. If the decision is not made up perfectly at a controlled laboratory setup or clinic, which means that if you go to a high standard hospitals such as the Aspidar Hospital, where it is a gold standard sports medicine setup is there, a lab specific rehabilitation protocol will be done. We follow it here at our hospital in our labs, where the athletes are put into proper supervised training. So if you see the prevention, yes, prevention is possible. However, it is not eccentric hamstring exercises, yo-yo curls, Nordic hamstring exercises, FIFA 11 plus program, all these can prevent a hamstring injury. However, an injury has to happen, it will happen. Now, there is a very recent research article which says that there is a hamstring injury index has been developed, which enhances, it is a combination of imaging, biomechanics, and data analysis combined into a protocol, and they identify a hamstring injury index in order to identify an injury as well as rehabilitate and return to play encouragement. So the functional assessment scale for acute hamstring injury, which is called as FASH, it is similar to the Parkey questionnaire, physical activity readiness questionnaire, where there are some 10 questions related to the hamstring injuries. Like to begin with, acute hamstring injury, what would be the rate of pain, whether you are currently taking part in a sport, how much pain do you have during walking, during jogging or slow pace running, how much of pain do you have during accelerating or sprinting. So it slowly progresses the questions depending upon the type of sport and the nature of the pain or the injury. The athletes are evaluated on a scale of 1 to 10. Now, coming to the last part, you need to understand whether the difference between the hamstring strain and the proximal hamstring tendinopathy. Okay, so the mechanism of injury for acute hamstring strain would be, sorry about that, I need to put the larger content into the one single PPT. So sorry about the letters if it is a little minimal. So the mechanism of injury for acute hamstring strain, as I mentioned in the slide before, the type 1 would be high speed running and type 2 would be overstretch. Whereas for a proximal hamstring tendinopathy, there is a direct mechanical overload or a repetitive stretch or strain happening over the muscle. The most commonest location for acute hamstring strain, type 1, it is biceps femoris, as I mentioned. Type 2, it is a proximal tendon near to the origin, which is a semimembranosus. Whereas the proximal hamstring tendinopathy, it is a semimembranosus that is mostly getting injured. Presentation of the injury would be for an acute strain, it is a sudden onset, there will be a pop sound, difficulty in continuing the sport. As you've seen in the previous diagram, the person will be clutching and falling down, or as you've seen in the Usain Bolt video. Whereas the proximal hamstring tendinopathy, there will be no specific inciting event, there will be gradual increase of pain. Physical examination, if you see the acute hamstring presents with ecchymosis, there will be may or may not be a palpable defect over the muscle, pain and weakness with the hip extension and knee flexion. For testing of the proximal hamstring tendon, the Prunian Orava test, bent knee stretch test, tenderness at the ischial tuberosity, no loss of stretch because it is a tendon that is involved in the proximal hamstring tendinopathy. Imaging will show that imaging is not exactly necessary when there is an acute hamstring strain, because unless and until there is an avulsion at the ischial part. Whereas proximal hamstring tendinopathy, MRI or ultrasound will show higher sensitivity. The conservative treatment would be the phase 1 decrease. The first thing is to decrease the pain, the RISE protocol, then slowly increases the exercise activity during the subacute phase, the chronic phase, then coming into the functional and neuromuscular training, depending upon the respective sport the athlete is playing. Whereas the proximal hamstring tendinopathy, you'll be concentrating on eccentric exercises, graduated return to activity, shockwave therapy and soft tissue mobilization can be encouraging. If you see pharmacological injections, corticosteroids or the PRP injections are mostly used for acute hamstring strain, whereas the same can be used for the hamstring tendinopathy as well. Return to play. For an acute hamstring strain, the faster recovery for type 1 strains happens, the shorter time to walk without pain. That means if the recovery is minimal or the injury is minimal, the return to play may be enhancing or early. Whereas full range of motion with no pain is an indicator for strength testing. So you need to achieve a full range of motion without a pain for a hamstring tendinopathy. So in a nutshell, the hamstring injuries generate the largest number of muscle injuries in pro sport. Analyzing prevention and treatment protocols are the way to carry out or way to deal with the hamstring injury. So handling the problem individually while continuing to study and analyzing the researching continuously would help us in dealing a hamstring injury better. Thank you very much. Any questions? Any questions are welcome.
Thank you, sir. That was a wonderful session. Sir, we having some doubt. So we have some question for you. What precaution therapists should be kept in mind while treating hamstring injuries?
What precaution? No, your question was what precaution, right?
Yes, sir.
See, hamstring injuries, it is the very trickiest of injuries to deal with. The trick lies in identification of the injury, whether it is the type 1 or the type 2, or whether it is a tendinopathy or an acute onset. So once you start identifying it properly, then you can correlate your rehabilitation protocol as per the injury that is. So analyzing identification as proper assessment of the injury is very key to dealing with that injury. Okay, there is one question here. Which sports have eccentric loading more, because of which hamstring injuries more? Any sport, I mean, that involves running, athletics like hurdles. You see the Usain Bolt running, cricketers running, footballers. So running activity loads the muscles eccentrically. Even marathon runners.
Sir, our next question is, what major problem therapist faces while treating hamstring injury?
Okay, what major problem therapist faces is the first number one problem I would say is return to play, because the athlete would be very eager to get back into the sport. And if it is a pro athlete or an international level athlete, you're treating, return to play will be the first and foremost criteria. However, in order to reach the return to play, you need to start the rehabilitation phase wise. As I mentioned, in the subacute phase, you need to start mobilizing early within the 3 to 5 days, then slowly progress it into isotonic or isokinetic exercises, then comes the functional exercises. So once you understand the protocol properly, automatically the rehabilitation happens on its own. Yeah, another, we have one question here. When we can start the shockwave therapy, as you have said, as one of the choice of treatment? Okay, shockwave therapy or ultrasound both deals with tissue healing as well as pain reduction, but not to a greater extent, because as I mentioned, hamstrings, I again repeat this, hamstring is the most trickiest injuries to deal with, because you do not know exactly the, what to say, the extent of the injury, or whether it is a reoccurrence or it is a fresh injury, or whether the player is poorly rehabilitated prior, or what is the fitness level of the athlete. So even though you can give a shockwave therapy or electrotherapy modality, any electrotherapy modality, it will be a temporary recovery process. However, the trick or the key lies in your rehabilitation exercises and how you are going to manage the athlete during the course of rehabilitation.
Sir, our next question is, what's the criteria for RTS?
Repetitive strains. RTS is repetitive strain. Okay. Hello.
Sir, it's return to sports.
Okay, return to sports. Yeah, see, return to sports, as I mentioned, you need to understand the proper assessment is mandatory, first of all. Whether it is type 1 or type 2, whether the athlete is I mean, the player is from athletes or a footballer or a cricketer or all-rounder or whatever the type of sport the athlete plays. Then if there is a game coming up, say for example, IPL happens in India, the IPL season is April and May. Imagine an important player gets injured in January, and return to play is targeted because IPL season happens in April or May. So your return to play, the time factor you have is 4 months, within which the player has to be rehabilitated. The strength aspect has to be monitored. The functional training has to happen properly. Then the player should not complain of any other pain or any other discomfort. Only then the player is allowed to get into the game activity. Then progressive loading, the sport specific training happens. So return to play is something that is time factor. Yeah.
Sir, when we can expect return to sports and the criteria for RTS in this injury?
Yeah, that is what, as I mentioned, see, return to sport is not something that can be predicted. The most recent thing, if you imagine, if you remember, cricket player Deepak Chahar was injured and he had a hamstring tear during the IPL, and he happened to miss the whole IPL season. And after which rehabilitation was carried out, and progressive rehabilitation, functional training, sports specific skills and drills were performed on him. After I think 7 months later, he joined the Indian cricket team. So return to play is something, even though you can expect that the player will be rehabilitated within 3 months or 6 months, it is not, it depends on the type of injury, it depends on the nature of the sport, it depends on the fitness level of the player, depends on the muscle strength of the hamstring, what type of tear has happened, what type of injury, type 1 or type 2, whether the injury is, if the injury is near to the ischial tuberosity, then the return to play will be much delayed because it is happening near to the origin of the muscle.
Sir, our next question is, how long we can carry the rehab process for hams post injury?
See, rehab process, as I mentioned, whatever I have put in the slides is a concise of various scientific evidences. The rehab process starts with isometric exercises, then you progress it into isokinetic and isotonic exercises, then progressive strength training, then comes the functional exercises. I have put a picture of the acute phase where you have 5 exercises, then the subacute way you have 4 exercises, then the chronic phase where the functional exercises are carried out with respect to the sport the athlete is playing. Anything else?
Sir, our next.
Please share the presentation on the WhatsApp group. I will try because the MB size is more. I'll put in a lot of videos as well. I'll try to concise it. Maybe I can edit those videos and just put the slides along.
So may I ask some queries?
Please, please, please.
Is there anything like hamstring reconstruction or sorry, in sports rehabilitation?
So reconstruction doesn't happen. The repair can happen. The grade 3 tear where there is excessive muscle damage, and if surgery is the only option that is that's going to heal the tendon or heal the muscle belly, surgery is not that frequently done for hamstrings unless and until there is a as I mentioned, 96% of the injury happens in a non-contact environment where the athletes self-injures themselves. So say for example, wrestling or karate or judo, where there is a contact environment, or even rugby, where there is eccentric loading, the person will be running and there is a contact happening. And where there is an excessive force getting into that muscle, causing it to grade 3 tear or a complete tear, that is where a surgery is done. And surgery is something that is the last thing the doctors will consider. I hope I have answered it.
Sir, we have one more question for you. What are the rehab techniques to strengthen the hamstring muscle to prevent the hamstring injury?
Prevention, if you say, I would take it as you are going to prevent the injury. The person has never had a hamstring tear or a hamstring injury, and you're planning to prevent it. Go for if it is a soccer player, go for the FIFA 11+, Nordic test, eccentric exercises, kinetic chain exercises involving functional activity of the whole limb. You should not concentrate only on the hamstrings alone. Just asking the person to lie on prone, just do the leg curls, it's not going to help at all. Functional exercises involving the 3 joints, the hip joint, the knee joint, and the ankle joints, will progressively strengthen the hamstrings, as well as the proprioception factor will also benefit the tendon at the insertion point. So prevention happens if there is a proper understanding of exercise prescription.
Any more questions? You can drop in the chat box.
I know this is a vast PPT I have put in because I need to collect data from various evidences and research articles. So I made sure that everything is concise properly. It may look dry, but anyway, I'll share the PPT without the videos for everybody to understand. Any correlation of hamstring injury with PFPS? Correlation of hamstring injury with PFPS, I can only correlate if the athlete has or the person has a poor dynamics or a poor muscle strength. Because patellofemoral pain syndrome is something that is happening in the anterior knee compartment, which is directly related to the poor core, poor hip flexor strength, and poor quadricep strength. If you consider hamstrings and correlating with the PFPS, weak quadriceps with tight hamstrings because the agonist antagonist react in the opposite direction. So you need to deload the hamstrings, maybe stretch, tape it, and then strengthen the quadriceps, strengthen the adductors. Any specific games in which hamstring injury is common? I showed you the videos: running, athletics, soccer, rugby. If there is hamstring injury in sports person, then there is, for him, there can be chance of deconditioning. I'm sorry, I didn't understand this question. Hamstring injury in sports person, there can be chance of deconditioning. Okay, let's take an example of the IPL again. Imagine some player is injured before just in front of the IPL, and luckily the player has been rehabilitated and he is returned to play and he is returned to the IPL. Okay, sorry for quoting IPL because that is one of the most popular games in our country. So deconditioning may happen if the rehabilitation is poor. Deconditioning will not happen because it is skill specific. If it is a bowler or a batsman, he will not forget to bowl, or the rhythm will not go because it is a skill set. However, deconditioning may happen if there is a poor rehabilitation or early return to play, or the return to play is not structured or planned properly. If due to deficiency of multivitamin can cause the hamstring injury in any report, I don't think so, because hamstring injury decrease in vitamin levels, not to my knowledge, because if there is a decrease in vitamin levels in the body, the whole body is going to get dysfunctional. There will be generalized weakness, anemia, and other associated symptoms. If it is an aged person, there could be sarcopenia, where there is muscle loss. So injury to one specific muscle correlating with multivitamin deficiency, I don't think that is common. Maybe if the person is doing some aggressive activities and he may injure, or muscle cramps may happen to some parts or individual specific muscles. On-field acute hamstring strain grade 2, what to do? Okay, on the field, what you can do is, first of all, see whether the player is able to manage himself. If it is a grade 2, say for example, if it is a soccer, then the player needs to continue to play the game. See whether the player is able to stand on the legs, weight bear, and jog. See whether you can tape him, do a muscle release, or maybe a stretch if required to the other parts of the muscles, other muscle groups. See whether the player is able to cope up with this and continue to play. If not, just take him out of the game.
Okay, sir.
Thank you, sir, for solving our doubt.
Thank you so much. It's been a pleasure.
Now I shall move towards the closing of today's session. We will see you soon tomorrow again. Thanks. For more queries, you can mail to us at devinder@bcip.ac.in.
Thank you very much, sir. Myself, Dr. Devinder. Am I audible to you, sir? We will be sharing the feedback link. I request all the audience to please fill the feedback form. There is some technical issue. We will be sharing it soon. I hope all of you are there on our WhatsApp group as well. If you are not there, please join there. So we will share it on the group because there is some technical error. The internet is not working, so we are not able to connect. So we'll share it on the group. Thank you all of you. So we are closing now.